We're now joined by Dr. Stephen Brunquell, who is president of the Englewood Health Physician Network. Good to see you, Doctor.
Happy to be here, Steve.
Doctor, the vaccine distribution as we speak right now at the end of April 2021, how are we doing, A, and B, we're about to talk about vaccine resistance.
So I think the good news is that we've done a pretty good job in getting vaccine out quickly to first and foremost our most elderly and our most vulnerable. And I think the rest of the population, now that everyone is eligible, those who want a vaccine, I think pretty much have been able to receive a vaccine. I know early on there was a lot of competition. There's a lot of availability as we speak right now. The next challenge is, as you mentioned, the vaccine hesitancy, the portion of the population that doesn't care for a vaccine at this moment.
So, Doctor, what would you say? I know I've asked so many really smart clinicians, healthcare experts this question, but there are a fair number of people watching right now. Some who say no, no way. Some who are still on the fence. As we do this program, the J&J situation is what it is. You know, I don't know what the federal government's going to do in terms of moving forward, but it had an impact. Let's just say that. For those who are still hesitant, what is the message you have for them in general? Then I'm going to ask you more specifically about women and pregnancy.
So I divide the hesitant folks into three groups. One are young people who, you remember being young, we were invincible. They feel that invincibility now. They say, well, if I get it, I'll be sick for a few days, who cares? I've heard even some parents say, why don't they just get it and sort of develop antibodies, sort of like chicken pox, and it's not a big deal. To which I say, yeah, but you have parents and you have grandparents. So that's one group. The second group are those in the Black and brown communities. And let's be perfectly honest, we are very aware of some of the disparities in our healthcare system that have been present for decades. When I started the vaccine process here at Englewood, I reached out to a number of the religious groups in our area, particularly the Black churches, and I was frankly stunned that several times they brought up the Tuskegee Syphilis Project, which, as your viewers may or may not be aware, was a federal program in the 1930s where the government intentionally inoculated Black men in Tuskegee, Alabama with the syphilis spirochete and deliberately infected them without their knowledge or their permission. That horror is still very much on the minds of Black people in our area, particularly older Blacks.
Rightfully so. Rightfully so, Doctor.
Absolutely rightfully so. I learned it in medical school, and I am as horrified today as I was then. But we need to break down that. And I tried to do that with some education with those folks, and basically saying, you're going to get the same vaccine that I got. But we have to understand their hesitancy because of that history. The third group is a group that either hasn't heard the data, rejects the data, listens to social media, or just says, I'll think about it, I'll do it some other time. That to me is the toughest group, because as you know, there's a lot of misinformation out there. And if you listen to social media and you listen to some of the conspiracy theories and the hoax theories and that it's going to change your DNA and the government's going to track you, I'm not quite sure how to get past some of that.
Yeah, and for women, particularly women who are either pregnant or want to get pregnant, what do they need to know from a clinical medical safety perspective?
So this is somewhat personal, since my son and daughter-in-law are planning on starting a family very soon. And so when the vaccine became available late in 2020, it was a big concern. And to be very frank, I was unsure of what to say to her. I think the data has been pretty clear. There is no evidence of any effect on mother or fetus from this vaccine. There is no safety concern about a woman who is pregnant or planning on becoming pregnant from getting this. And one of the things I would add to them, to say to them, is that it would be far worse for you to be ill with COVID when you're pregnant than to get a vaccine.
Real quick on this, Journal Square, Jersey City, right?
Yeah.
Englewood Medical Complex opening in the fall.
Late in the fall, yes.
What is it and why does it matter? Especially as we talk about underserved communities.
Steve, we're making a huge commitment to the community of Jersey City, which, as you know, is just expanding by leaps and bounds. We are building about 75,000 square feet. It's a true multi-specialty office with all the primary care, medical, surgical subspecialties. We'll have a diabetes center. We're considering a specific program to address asthma in the city. We'll have radiology. We'll have urgent care. We have a number of practices in the Englewood Health Physician Network in Jersey City now. So we'll be consolidating them and expanding the services to that community.
Got about 30, 40 seconds left. By the way, Englewood Health, one of the healthcare organizations that support what we do. But real quick, for those who say, I'm done, literally, I'm done with COVID, as if COVID doesn't have something to say about that. COVID fatigue, 30 seconds, go.
I think we're all exhausted by COVID fatigue, and the only way out of this is to get a vaccine. All the people at Englewood Hospital right now who have COVID, none of them had a vaccine. Nobody getting a vaccine, zero. Nobody is being admitted to the hospital who has had a COVID vaccine. It's as simple as that. And you know what, Steve? The sickest people are my age and your age. They're not the very elderly. They're people who have a lot of years left. And it's tragic to see this happen to them. And there's no good reason for it now.
I don't know what there is to say after that because it speaks volumes. Most importantly, thank you for everything you and all of your colleagues are doing, particularly on the front lines, to protect all of us, and also best to you and your family as it expands.
And thank you so much. And thanks for getting this message out about vaccine hesitancy. It is the most important thing we should do right now.
It is our honor. Thank you, Doctor. I'm Steve Adubato, and we thank you for being with us. And we'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by IBEW Local 102, Bank of America, the Robert Wood Johnson Foundation, MD Advantage Insurance Company, NJM Insurance Group, Operating Engineers, Local 825, New Jersey Sharing Network, Choose New Jersey, and by NJ Best. Promotional support provided by New Jersey Globe and by AM 970 The Answer.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders. The people who make our state a great place to call home. NJM, we've got New Jersey covered.